Good afternoon and welcome to Webinar Wednesday. Today we are joined by Ty Greenhalgh, Industry Principal Healthcare at Medigate by Clarity, and Jessica Davis, Director of Marketing at First Health Advisory. Webinar Wednesday would like to thank our sponsor, Medigate by Clarity. As the world's most trusted healthcare cybersecurity company, Medigate by Clarity empowers HDOs to comprehensively monitor and manage risk across their healthcare extended Internet of Things environment. Whether it be through a medical device or a building management system, attack surfaces grow as connected assets expand, creating security blind spots that pose risks to availability, integrity, and safety. Clarity tackles these risks to ensure cyber and operational resilience are within your reach. For more information, please visit clarity.com. Just a quick reminder to save the date for our full MD Expo. We're headed to the Carib Royal Hotel in Florida from October the 29th to the 31st. So please join us for 3 days of education, networking, and the latest advances in medical technology products and services. Registration is now open, so for more details, please visit mdexposhow.com. Also, there's a copy of the pre-show planner, and that can be found in the handout section of your webinar dashboard. Today's webinar is eligible for 1 CE credit from the ACI, and you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. Okay, let's kick off today's webinar by giving away one of our Webinar Wednesday t-shirts to the attendee that can tell me the answer to the following trivial question. July is National Hot Dog Month, so what is the most popular hot dog topping? Answer now using the questions feature on your dashboard, and I'll reveal the answer at the end of the webinar. We'll wrap up today's presentation with a live Q&A, so please submit your questions anytime using the questions feature on your dashboard too. As I mentioned earlier, our presenters today are Ty Greenhalgh and Jessica Davis, and they will be discussing Reporting from the Frontline, a journalist's perspective of the cyber war raging in healthcare. So Ty, you may begin whenever you're ready.
Thank you very much, Linda. We're just delighted to be here. I do think my answer of a bun is the best topping for a hot dog. Should have been on the list, but it's not. So if anybody out there, don't guess bun. But today is going to be a little bit different. For years I've tuned into Webinar Wednesdays and really have learned a lot. A lot of these are product centric, and you're talking about bits and bytes and features and functions, and well, that's all good. I thought we would do something a little different today, kind of keep it higher level. Maybe looking at the battlefield and what's really going on out there, and how you can plug in, where can you go for more information? How can you use a knowledge of the landscape to kind of foster your growth in your career? And so I've followed Jessica for years, reading her stuff, and boy, I learned a lot from her writing, and just thought, what a great thing to do, just to kind of have a casual dialogue. So Jessica and I have not gone through this. We haven't rehearsed a bunch of stuff. And so we've just got topics we're going to talk about, but I have a sneaking suspicion they're going to be very interesting and very informative. And so kind of with that, introduce Jessica. If you could say hi to everybody and introduce yourself, give us a little bit of background on you, and kind of how you worked your way through the world of writing. How'd you get here?
Hi. Well, yes, as you mentioned, my name is Jessica Davis. I'm the Director of Marketing and Communications with First Health. I just joined about a month ago. Before that, for about 8 years, I covered healthcare cybersecurity from Healthcare IT News, Xtelligent Media, and most recently, I attempted to bring healthcare challenges, to the mainstream with SC Media as a healthcare cyber thought leader. I think, for me, it started in 2016. It just happened to join at the right time. I gave up freelancing and moved to HIMSS Media, and that's sort of when I guess they don't correlate, but the ransomware attacks began, against MedStar and Hollywood Presbyterian, and I really sort of understood that healthcare was kind of caught off guard. Awareness at that point was pretty low. So, I sort of began obsessing about it. I think there's a real problem here, and for me, it's really about wondering how we all can work together. And so I think that, while it's common to call the shift from journalism into marketing a walk on the dark side, but I moved to First Health Advisory to join the Jedis, if you will. I think that traditional B2B media is not really reaching a broad enough audience, and we really need to be spotlighting these issues. And so I really wanted to join a team with these invaluable resources, that were available at my disposure. So I kind of want to make sure that their voice is being amplified because they're doing the work on the ground. I'm really hoping that, so I'm looking forward to this discussion so we can talk more about those items.
Super. So just on that, let's take the opportunity to, what about, this won't be a presentation about First Health Advisory, but what about First Health Advisory? What are they doing that, because really I think they're just one of the deepest benches around for helping healthcare organizations. What is it about the group, this company specifically, that you think, by you coming on board is going to, they're going to help move the needle?
I think that the industry would agree that when reading my coverage, it's not the same as some others where it's FUD, the fear and uncertainty and doubt. It comes from a place of passion. And its CEO, Carter Groom, and I spoke for years, on these topics, not for stories necessarily, although they did inform it. It became apparent that passion was very real. It wasn't necessarily about selling something. In fact, I actually didn't really know what First Health did for a long time, and I have been working with them for years. So, they have team members on the ground that have, their consultants. They have years of experience in the healthcare space. So it's not like, a vendor without healthcare experience attempting to sell security measures. They're really working with those who need it the most on the ground, and it's rooted in healthcare experience, like decades. So I think it comes from a mutual space of like, there's a problem and how can we fix it? And that's the first priority rather than let's sell some stuff,
Yeah, no, I would concur.
I feel like you may notice the vendors too, and there's a lot of pitching when you're a journalist, and I've never been pitched by First Health, never.
So what have you? Can you talk a little bit about what it's like to be an investigative reporter, and what does that even look like?
It looks like frustration over lots of news heads covering every single breach and throwing every provider under the bus as if they have done something terribly wrong. I think anyone that knows me knows I'm very passionate, and I kind of find a thread and I pull and I pull and I pull until it comes to its source, and not until I get tired of pulling. And I think that it's that approach that creates more tangible information, right? So we know that healthcare is among the hardest hit. We know this. Everyone talks about that it's an inevitable situation that you'll find yourself in a breach or at least a security incident. Whether you contain it or not is beside the point. We know it's inevitable. I think that FUD is real, and for me, I wanted to counter that, right? We have, we are aware of the challenges, which is based in, resources and staffing and whatnot. It's not just like providers not caring. It's that they want to do more, but they don't know how, or they can't afford it. So for me, I think that I wanted to be the counter voice to the FUD. And I think that, what's really important, and the way I approach things is sort of what matters, is, how the news ties into trends and what those trends are saying. How do we solve those common issues? How do we bring all of these people that do have the expertise and the background behind them together, force them to talk to each other, or at least put, I love to put vendors, competing vendors on the same story, because if we all put our heads together, we can really figure out what to do here, right? I mean, how are providers keeping up on vulnerability disclosures? Is Congress actually going to help? And I think that, every vendor in this space, every network defender really needs to approach news and stories in the same way. Like, what does this mean for me? Because it's great to grab a headline. I don't think that really matters here. I think after, it's been 7-8 years of just nonstop breaches and healthcare issues. It's kind of white noise at this point. So what really would stand out and what matters is how it applies and what we can do with that information.
So do you think that you talk about the white noise pieces? Do you think that that's becoming an issue where we're getting complacent, like, oh, it's just another breach?
I don't know if complacent is the word. I think that we quickly forget just how frequently and how much is going on. I mean, I think that it's really great to grab on a head, like, like the breaches now cost $11 million, but is that applicable for us? Maybe not. I think that what's more applicable is, how is care being affected, right? Like, that matters. The bottom line matters, yes, but is that going to get a low resource provider without the budget more money? Probably not, right? I mean, so I don't think we're complacent. I think that we're focusing on the wrong things, and we're quickly forgetting where we've come from and not building on it, right?
Yeah. So have you always been a curious person? I mean, is this what?
Yes. I just think that, when you care about something, and I think with healthcare, it's easy to care, right? There's patient safety, it's patient care, it's, it's that. And I think that when you care about something, that's when, that sparks that sort of approach. If you approach it as like a normal media story, then yeah, you're going to like write headlines rather than care about the substance. And I think that in healthcare, it's sort of easy to be obsessive and curious, right?
Yeah, I think that's why I think you hit the nail on the head. I think, so many of us, including myself, you could make more money some other place, some other industry, but you don't necessarily have feel the same value for contributing to a worthy cause as healthcare, and in this case, I would suggest protecting our healthcare, and we're going to be talking a lot about, obviously the protection side of it.
I think there's just a vast difference between, not that Morgan Stanley has, but like if Morgan Stanley with this huge budget and revenue, right, gets hit, that's a news-breaking story that we should be, questioning whether or not they have the right security measures in place. That is where that should be applied. But in healthcare, it's different, right? Where you have the haves and they're doing it as well as they can. But when we have health system leaders saying things like, you just sort of have to accept a certain amount of risk, and that's the standard, right? If you put that same approach in other industries, it wouldn't apply. So the same thing, you can't approach healthcare in that way. It can't, because it's simply not the same. And I think that we are very quick to judge in most things. And I think in healthcare, I don't think that should be our first measure. I'm not saying that everyone is, of course, without fault in healthcare. To be clear, there's a lot of that. But I do think that it's just simply different, and that you can't just blame first. And that name and shame nonsense, I think it's got to stop.
Yeah, so true. I think that for you to have been so successful, I'm just imagining the situation that you're going into. Say someone's had a breach in a hospital, they don't necessarily really want to talk to anybody, or they have issues, or they have concerns, don't necessarily want it really to get out into the media. So many times, I don't think they're all breaches are getting reported for that same reason. So is it a difficult task to go in and try and talk with these executives? I imagine that you must have to build some trust there.
Correct, and I do think that I, like most reporters, have the same problem, which is that we don't want to talk. If I had $1 for every time I had a PR person come back and say, well, that's not exactly the right language to be using. It's like, well, it means the same thing, so trying to contain, right? They have a job to contain the reputation, but I do think that they're on a public facing route. Yeah, you're not going to get an executive to talk. It is nearly impossible. For me, and where I've been able to succeed, is that you build trust by helping them understand that you can happily be off record and background with me. How can I help? Right. I know that you and I have talked about this, and I won't name names because I think that's really not helpful here, but there was an eye care vendor. There was a lawsuit. They hadn't reported several ransomware incidents, both to their clients and to the public. They sued because they couldn't bill patients. There's mass amount of outages, and that sort of desire to hold that information in and protect the business rather than patients and their clients, that was a huge challenge. I got the providers to talk to me off record so I could hear their stories, because several months after the lawsuit, they did announce a ransomware attack, but that was not connected supposedly to this initial incident, right? So I think that for me was sort of a confirmation that it's still a business. There are still, just because some providers really, that other thing too, just to be clear, is that these providers didn't really know how or where to approach. And that comes from not having people on the team directing that, getting into contracts that without understanding what it means. There's a lot of that. But I do think that there's still that knowledge gap. And I think that, so I do think that there's still a challenge in getting people to talk. And I think that's where we find groups like Health ISAC like very, very important, because you can talk in the background and not deal with the media. But I mean, from a media perspective, it's not easy. And I don't think I've had a lot of success in getting executives to actually speak to me. It's very, very tight.
So you're thinking that the information sharing is much more effective than the FUD, the fear, uncertainty, and doubt.
Absolutely, but I think that where that's happening and we're finding success, and that's gotten better in recent years, is in the background. And frankly, given the way that media tends to jump on these things and sort of continue to broadcast the worst parts of something, right? You've had a horrible day, right? If it's an inevitable breach, right? They've had a horrible day, and media jumps on and sort of blasts it out. Who's going to want to share that, right? But if you take it to a threat sharing group and you share it in the background, right, that kind of information is super important. And I also think that is increasing because people are realizing, attacks are regional based, they're based on size. And if you can learn from your peers, that is sort of where that's at. I don't blame them from not wanting to talk to us, frankly.
Yeah.
I mean,
especially with the way the regulations and punishments are set up right now.
I would agree. I don't know if that has weight in that. I think it's more about reputational harm and how it's viewed, and how every single media outlet covers every breach as if it's like, this provider did X, Y, and Z. And again, that's not to say that these providers are not at fault for like not taking the right actions. I can't speak to that, and I don't think that we should assume that everyone's blameless. But I do think that we're focusing on the wrong thing in coverage, and it's sort of disparaging, or discouraging people from wanting to publicly share their stories. There have been several that have been honest about it, but I've noted that the Ireland health executive, they had, it was an entire summer with the entire public health system down, right? They came out with a third-party audited report that explained what happened, why they ignored several alerts. They didn't respond in the correct way to certain elements, but that piece of information was so invaluable, right? Because we can take that and build from that. But the difference is that's in Ireland, right? It's a public health system. There's different, it's not a lack of, they have a responsibility to the public to show what's going on, but they don't also have that same competitive spirit that the US has. But that kind of information, like that is what we need, but we're not going to get that in the front level, I don't think. Not that kind of transparency.
Well, we just had another breach. HCA got hit. That was a big one. But as you can see here, it's, you know, the number of records are, you know, just continue to climb as far as the ransomware or the extortion goes, and there's shades of gray on the landscape of how they're extorting. I think ransomware is coming down. Is that true? And kind of a double extortion, triple extortion is on the rise. The more hands-on keyboard type of hacks are going on. That seems to be rising. Is that, do you have
I don't think that we can, so everybody has an opinion about it, right? So it depends on who you ask, depends on what is happening, right? I think ransomware is just as problematic as ever. There have been at least 24 health systems that, or health connected, like, you know, pharmacies that have fallen victim, or excuse me, been hit by ransomware and been shut down so far this year. I don't think we can say, and I can't see, I think the last time I saw numbers like that, it was during the pandemic. Thank you, Klopp. But I do think that, and I have seen recently that there is a new, like Klopp ransomware report shows up with the Move It vulnerability. They're not actually deploying the ransomware. They're just taking all the data that they can and then immediately moving to extort. So there are groups that continue to evolve. I don't know if focusing on whether ransomware is declining is really the right take, because I mean the data is conflated. Even no one can agree upon that, I guess is what I'm trying to say.
Yeah. Well, it's not going. I mean, it's not going away, so you can't drop your guard. I guess it's more, you know, where are the bad guys pivoting? We know that through some of the studies, they're getting faster, if nothing else. So, you know, we need to be cognizant of what we're doing, what our plans are, our incident response plans, and that we need to be able to move more quickly based on what's happening. I think you had provided some trends that you had seen, kind of looking at this from a time perspective. What things here stand out to you? You know, kind of drawing the information out of this data. What jumps out at you here?
Well, the size, right? And I think that, well, in 2016, I put not applicable because at that time, until August of 2016, OCR hadn't really planted its flag and said ransomware, the onus of whether or not your data has been breached during a ransomware attack is on the provider, and you need to show without a verifiable, like without a shadow of doubt that the data wasn't accessed. And since you can't, a lot of that wasn't reported before OCR sort of said, no, this needs to happen. So I think the data for that isn't, but that was the year where it really became full force. And I think that, you know, we weren't prepared. And that's sort of where we saw the uptick in vendors selling solutions and like snake oil nonsense. And I think that what's happened is that we are now very aware but it still hasn't really affected the posture overall. I mean, the have-nots in healthcare are still struggling, and I think that's what we're seeing here. That and the threats are increasing. They're still getting in the same way in a lot of these. You know, phishing is common. Social engineering has improved in sophistication. They're still, you know, tapping into unpatched vulnerabilities and using that as a door. You know, but I think what we're seeing here is just easier for them to move around. I don't think, you know, I think that it really is more that we are aware, but this really spotlights to me that it's just as easy to get in as it's ever been, and that threat actors have more time and there are more of them, and they're just really having a field day.
Yeah, ransomware as a service is something that is seems to be growing. Are you finding that that's the case?
And that's sort of what it is too, right? Because like they take that sort of effective ransomware variant and they expose. They have certain rules to follow. Not always, they don't always do that, but I do think when you have an effective malware strain and you sort of give it to others, I think you know, that makes it easier to deploy what you're doing here. And I think that another thing too, I mean, it doesn't need to be all doom and gloom, right? Because I mean, federal actions this year have taken down at least one, I think it was the largest stolen credential marketplace in history. I mean, they're going to rebuild, right?
Genesis?
I think it was Genesis, yeah. They just arrested one of their primary hackers there too. So, you know, it is whack-a-mole. I do think that to create something that as large as Genesis was is difficult. And when I covered this in the past, I think the sentiment was that this is whack-a-mole. Yes, they will rebuild, but it's going to take time. I think it's sort of, you know, creating an ebb, but they're going to rebuild. So while, like, for example, like during the pandemic when we're all like sort of like calmed down and focused on other things, right? The whole sentiment from like industry leaders is like, use this time wisely if ransomware is in decline to fix those gaps, make it harder for them to get in. So I do think ransomware as a service has made it easier for anyone to fall victim. And I think that if you're not actively working toward, like, you know, the task force HICP, their guidance, you know, and putting those items into place, I mean, it's sort of broken down for you. I think that you're doing yourself a disservice because yeah, they're just not going to stop.
Totally agree. It's profitable. It's profitable. Where they're not going to keep. They're not going to stop coming. So this is a report that just came out. I mean, very recently, and I thought it was just interesting to see once again, you know, 13 consecutive years that that graph has looked that way. That from a cost of a data breach by industry, healthcare is number one. And then you throw on the other side of that candle the fact that we are the number one most valued record because we've got more data in it for the financial information, the pharmaceutical information, the health insurance information, the billing information, all sorts of information that can be used in a number of different ways. It creates a much more valuable record than any other industry. We just, you know, we get hit more, therefore, and it hurts more. So, you know, a lot of but from an average perspective, we're $4.5 million is the industry average, and we're at almost 11 from a cost perspective. And then we've just got a, you know, huge number of regulations. You can go out and download this report if anyone is interested. Easy to find online. Any comments on this screen?
Yeah, because I think that it also doesn't take into account, you know, just plain cyber attacks and how much outages cost. Like if you think about like the Universal Health Services attack, I think that was 67 million, and they were down for only 4 weeks, and that's like lost revenue, that's recovery costs. I mean, it's a pretty big health system, so you have to take that into consideration. But I mean, 67, someone can do the math. I'm pretty sure that's like 2 million a day. I'm not a mathematician, I can't. But I mean, the same from like the Ireland Health Service, that was 60 million. I think Scripps was 62 million. I think that, yeah, there's staggering costs because, you know, there's it's healthcare, it's expensive. We talk about that a lot too.
Yeah, I was just watching a presentation at Amy, and they were going over those same accounts, and you know, those numbers just keep rising as they, oh, we need to add in this, we need to add in this, you know, and those numbers just get bigger and bigger. So it's you know, there's so many, and then the loss of business, right? Because people, it's not like you lose your credit card and you just need to go get a new credit card. This is your medical record, and that's going to cause you problems for years, especially if they're taking it, chopping it up, and selling it, and using your data in a number of different ways. You're probably going to take your business someplace else. And so there's just all sorts of costs that are incurred that make this, especially when hospitals are living on a razor's edge financially, as it stands. So you had mentioned kind of your timelines were back around the 2017. So I thought I would bring this up. This is kind of where it started for me. 2015 was the Senator Warner from the great state of Virginia, which is where I am, and he put together probably the most comprehensive piece of cyber legislation called the Cybersecurity Information Sharing Act back in 2015. In it was a section 405D that was a particular call out for healthcare, because healthcare is a critical infrastructure, and basically if it goes down, we all hurt, you know? So really calling that out as let's take a look into that. And they said do a risk analysis of the industry across the United States, and then go do something about it, basically. And on the left is what the risk analysis came back with, where, you know, we're talking about, we got a lack of security talent. The legacy equipment for medical devices, it's different. You keep the big iron around for forever. These infusion pumps, you know, you keep them going as long as you can, and a lot of that is going in and get a new device is not going to generate the ability to charge more, and therefore you can't justify going and buying a new machine if the old one is working and you're still able to accomplish the task and bill for it. So from a business perspective, you keep these things going. So I always say life supports on life support. The hyperconnectivity, the networks they brought the building management systems, and then the hospital clinical information systems. They brought all these networks together, and they did not have segmentation. So they call that a very flat organization with a very large blast radius. And then the meaningful use piece brought all the medical devices online, just as trying to share information and create that EMR and that efficient sharing of getting the value out of the data. So we created a very hyper-connective environment without thinking about security. And as you had mentioned earlier, the patient care piece, and then vulnerabilities in all these devices. So, you know, all of those are those we knew about those back in, you know, 2017, 2018. And then over to the right are, you know, some of the areas that, you know, we still struggle with today. And, you know, any comments on, you know, any of that, and or the challenges that we're facing today there, Jessica? I can't hear your audio.
Hi.
Yeah, I can hear you now.
Okay. You forgot my favorite stat, which is from that report, which is 3 out of 4 hospitals were operating without a security meter. That hasn't really shifted all that much, but they did update the 405D analysis, which contains some of the same problems that you're talking about. I do think that legacy devices are a huge challenge and they continue to expand. I think that the FDA, I'm not sure if you saw recently, obviously the October 1st deadline, where they're going to begin rejecting devices for not meeting security requirements. After that was announced, I did talk with someone who was formerly with the FDA, and they've said that they're already bouncing medical devices for not meeting those standards, which and offering support, but that support ends and that sort of no, this does not work. That's happening by October 1st. And I think that does a huge service for future devices and making sure that those patient touching devices, are secure. But I do think that legacy devices will continue to be a challenge as long as we're not prioritizing the investments in that technology. If we're prioritizing other elements and bringing on new devices rather than replacing those MRIs and things like that, and you can't just put it around a firewall. I think it's the most traumatizing thing I've ever heard a vendor say in a non-healthcare conference was that I don't worry about legacy devices because you can put a firewall around it. So I think as long as we have vendors that are continuing to not educate themselves and providers sort of feel intimidated by this massive project that medical devices are, I think that we're definitely going to continue to see that used as, struggle. We need support. Risk assessments are really important. Talk to a consultant if you don't. I think that sometimes we just need help. And I think in healthcare, we're so afraid of saying, I can't tackle this massive challenge. I don't have the expertise for that. I think that we should just sort of begin to admit our faults and lean on each other, because I think that's the only thing that's really going to move this, the current state of things.
Yeah, I couldn't agree more. When talking about this screen talks about a lot of the activity that's going on currently. These are all very current documents. So the FDA Patch Act over on the left with respect to giving the FDA new powers there, which is awesome. It feeds into this White House national cybersecurity strategy there, where there's 5 pillars. It's across all the infrastructures, critical infrastructures, healthcare, and public health being one of them. So in the middle there, that middle pillar really is the driving security and resilience, shape market forces. The shifting of liabilities is really where that is going to fall into, where the FDA is saying, hey, look, we're pushing the responsibility back to the medical device manufacturer to make these devices better. You have better cybersecurity over the life cycle. So all of this is really kind of woven together. The other White House pillar on the far left is defend critical infrastructure, and they're working on minimum requirements, and those minimum requirements, what should they be? Because I think the government feels like, hey, look, we've given since 2016 the industry the ability to figure out what it needs to do to protect the patients and the data, but we obviously don't seem to be doing a good enough job. And so the government's is now stepping in right now and saying, well, how much do we regulate? How much do we demand? And so that's all these areas are kind of working on that. And to your point, you've mentioned the 405D under Department of Health and Human Services, the health industry cybersecurity practices. That's up in the far right-hand corner. That's a set of practices that is I think that's one of the main areas that they'll be looking for if they had to mandate what some practices would be, that's one area they're going to look for. The Security Infrastructure and Security Agency, CISA, they've got CPGs, cybersecurity performance goals. They'll probably be in there too. For people who are looking like data, like Jessica likes data, that's Hospital Cyber Resiliency Initiative landscape analysis, full of data, kind of compiling a lot of studies and then comparing it to the health industry cybersecurity practices, which we call HIPAA. I'm a member on that committee, that workforce task group, and so kind of comparing them to see which mitigations work real well there. I'll also say that Carter Groom, the CEO of First Health Advisory, where you are now, is also heavily involved in driving this forward. So you're talking about one of the champions, one of the good guys, not worried about going out and just making a dollar, but trying to move the industry. You got to call Carter out in your organization. I mean, our organization too, but I definitely want everybody to know that really Carter's doing a great job there and trying to move a lot of this forward. And I think you also said something about the FTC, the
FTA, yeah, the October 1st deadline, the Patch Act, yeah. I will say, to add on to that, I think that I have never received more pushback on anything than when I wrote a piece that said, what if the security of medical devices, the onus for securing medical devices was put back on the manufacturer? I don't think I've ever received so much hate mail. And then the FDA came out with it 6 months later, and I was like, I told you. And Josh Foreman with I Am the Calvary has, I recently saw him speak, and he was like, we've been talking about this for decades. If you're a manufacturer in healthcare, like medical devices, and you're surprised by this news, you have not been paying attention. Full stop. And if you don't want to work on this, don't be providing medical devices. It's that simple. I mean, we need a secure infrastructure. We have legacy devices. Eventually, they will phase out. We are trying to build a secure future so that there's fewer legacy devices. I think that's going to go a long way, and I do think it's interesting. I also think the Warner paper was also fascinating to me because it is asking for things that essentially industry leaders, like Carter and I have been talking about for years. Let's incentivize providers to implement, those HICP practices. I mean, why not? Like, here's a step, let's break it down. Let's use that instead of, expecting providers to start from scratch or use security mechanisms that are outlined specifically in this that perhaps don't apply to the healthcare network. It's just fascinating to me. We're definitely moving, and Congress is paying attention.
Yeah, I can't stress that enough. There's the Warner paper. It was and that's a really great read too. It sets like the tone of. I mean, this is the guy who wrote the first 2015 cybersecurity legislation, and then now he's calling these. It's like 16, 17 policies. Like, it's just questions like, let's consider these are the areas of consideration. And it's on workforce and the grants and how that might be done, kind of a cash for clunkers thing on the legacy devices. Or what about HIPAA in general? I mean, HIPAA is like what, 1990s, right? It's there was a lot in there.
42 controls. HIPAA has just 42 security controls compared to NIST, which has hundreds that are routinely updated. HIPAA is just there. It's just there. It's existed from the 90s. It certainly wasn't built for digital health in any way, shape, or form, but yet that's our standard. And if you look at, I know Synergist Act up until recently had been releasing a compliance report, and I think it's still a quarter of providers like failing to meet compliance standards with HIPAA, and that sort of blows my mind. We can't do HIPAA with 42. It's interesting. It's an interesting conundrum we find ourselves in. But I do think that, yeah, sorry.
I was going to say another thing that you brought up, which I thought was really interesting, is you're really coming to the defense of HDOs and healthcare leaders. It's you were saying they aren't failing, and why? Can you explain what that viewpoint is? Because you're absolutely not alone there. What can you give us a little more on that?
I don't think that we should. I don't think they're necessarily not failing. To be clear, I think that we blame a lot and we put all of this onto them, where they're essentially being asked to do the impossible with not enough. Budget issues have always been issues in healthcare. That is not a new thing. That is not a trend. But for example, right, if you're a security leader and you have an incredible amount of talent, one of my favorite CISOs out in one of the health systems on the East Coast often says, you know, if you have security talent, are you going to work for Microsoft and make a ton of money, or are you going to work in healthcare where you're going to get paid significantly less and asked to do significantly more with not enough tools to do it, right? So my perspective isn't necessarily that they're not failing. I think we're, you know, there's too many, you know, board members and C-suite members that perhaps don't have the security expertise. They buy up tools that they don't know how to use, or they don't have the staff to properly implement them. You know, there are a lot of gaps, and I think it starts with knowledge and resources. And I think that we're just applying things in the wrong areas, and that sort of starts with understanding where to invest, and not just like throwing money at a problem and expecting it to be solved, right? And that takes talent. I remember the same CISO from the East Coast, you know, he was like, well, we should definitely consider a program where we incentivize security talent to join healthcare, sort of like, you know, as like a service to your country, right? Why, like something like that. And it's far-fetched, but it shouldn't be, right? Because as we were talking about before this call, I think that covering healthcare and being involved in healthcare cyber, it takes passion and concern, right? You have to want to help solve the issue. And I think that, I don't think it's necessarily that security leaders aren't failing. I just don't think they have all of the tools that are needed or the support that's needed. And I think that's where Warner's paper comes into play. I mean, he has a background in IT and telecom, so he knows what he's talking about. And we need that incentivization, we need workforce development, and we need this support. Like, and I think that that's why I don't give them a pass, but I tend to blame third or fourth down the list rather than just assume that they're, you know, terrible people that have allowed this to happen.
Yeah, I couldn't, you're absolutely spot on there. And, you know, there's the HSCAC, which is it's a work group for healthcare in the Senate. And, you know, they've got some bills that they're setting up for rural hospitals and supporting, you know, workforce and workforce development. And, you know, the White House is engaged, the Congress is engaged, the House is engaged, HHS is engaged, everybody's engaged nowadays on trying to solve this problem. And, you know, we're what the real, I mean, what the thing that's moving everybody is like you said in the beginning of this, it's taking the focus off of just the data or the money, the cost, or is that there is evidence now that suggests that, and it's not hard to, you can take away all the statistics and just say, okay, well, if a nurse is taking care of 14 patients with a bunch of medical equipment and computers and systems, and you take all that away from them, they can't do the same level of care with that same amount of patients. And so the quality of care is going down, and therefore outcomes are going to suffer. Now, so that's the morbidity, you know, is impacted. Mortality, I don't know. I mean, I think that's a whole nother argument people go back and forth on. But you were talking about Christian Demeth and Jeff Tully, who are two doctors at UCSD that are also hackers that, you know, have really been a force in this area. Can you talk to just for a minute about what they're doing around patient safety?
They've been hacking medical devices since I think before the surge, just to demonstrate possible patient safety impacts that occur when ransomware or a hacker shuts down a device. I appreciate that. I remember Christian Demeth telling me that he started as a hacker and then became a doctor. So for him, this is sort of a hobby, but a passion project, I would say. Again, speaking to why this is such having that caring aspect matters. But he would crack into them. So it's interesting. It had been a tangential, a hypothetical. And what I find interesting about it now is that we always said that when the patient is supposedly hurt or impacted, that's when we're going to start to care about cyber. And it still, nothing has really changed. But he and Tully, they're both at USCSC, and they talk a lot about the risk posed by legacy devices, that there's a chasm between biomedical departments and IT and security, where, you know, if a device starts acting up, they don't necessarily, the security team doesn't necessarily get that information, so then they can't attribute it to ransomware. So what's really important is that they essentially, they don't mention the Scripps Health attack in this recent report that was published in JAMA, but it's in the notes that Scripps was hit. We all know about it, May 2020, 4 weeks down. What they talk about is the data that they examined from those regional hospitals, including UCSD, where the wait times, how the influx of emergency care patients, everything surrounding the impacted hospitals, right? Because we have these tangential stories for the hospitals that have been hit, and you have patients telling the media, it took me 8 hours to be seen by a doctor, right? If you're a stroke care patient, every minute counts. So this kind of data is incredibly important, because it's like flagging the ground, like this affects not just the victim, it affects nearby hospitals, and it is actually impacting care morbidity. It confirmed that. And I know there's been like news stories and lawsuits where a baby could have died from a lack of tech. You know, there's a heart attack patient out in Germany, but this is like actual concrete data, not just stories. I think there was a CISA paper of it that wasn't published that talked about the same thing, which sort of confirmed cyber attacks. I mean, it's common sense, right? But I think without data, like, people tend to just sort of say, well, that's just sort of FUD. I think that's what we're used to. But it's really important to understand that, like, the length of outages it's becoming a problem for everyone. You know, I think that healthcare was one of the most recent, and I think they're just now getting up 2 months later after an attack. That's insane.
Yeah, you've got, I mean, the impact is real when you start diverting hospital ambulances, which occurs. I mean, UHS, it was Common Spirit, you know, I mean, you start diverting these ambulances, and that creates an overload in other areas, and that is going to affect outcomes. And then, especially for, you know, things that, like you said, a CT, like if you needed to access a CT machine for a stroke, you got to know in minutes, or else, you know, the person may not die, but they also may not walk. So it's this is the focus. We're shifting the focus, and with it, the government has really changed and stepped up their interest level. So kind of summarizing some of this stuff. Basically, you know, you hospitals are looking to discover their devices. They have to find their devices on the network, whether it's a medical device, whether it's IT, whether it's building management systems, or Internet of Things, you know, a camera, a television, a vending machine, you know, all of these devices that you need to be able to find them, and then do vulnerability. What are the vulnerabilities and the risk? Which ones are most critical? How do we protect them on the network? What are the indicators of compromise? And, you know, what are the threats? And then all of the device detail that you want to be able to collect on this: firmware, operating system versions, make and models. Looking at it, the life cycle, which the FDA is really focusing on, a lot of life cycle management right now, and then integrating all of that data into all of the other systems. And the thing that I would just point out is that the current, like, IT-based solutions for medical device, for security, don't work well with IOMT, BMS, and IoT. They don't. And so you need another level of discovery. And in doing that, if you take those categories and you compare them to the best practices that from the health industry cybersecurity practices that we talked about, like what's the government, you know, what's the document the government is going to? These are in that document. I'm not sure, I'm not saying that this is going to be a requirement that's coming out, but it aligns with the source data that they're looking for, and all of these line up perfectly for what it is that needs to be done. And then I go back to FHA, because so many organizations get here, and this is whether you're looking at Medigate or you're looking at any of the other competition out there. I mean, we're best in class 3 years in a row. Please include us in an evaluation, and we'll let you know why people select us, all the time. But getting it operationalized is really FHA's, one of FHA's strong suits. And so you can have the greatest system, and some people just need help. Some people need more help than others. Would you agree?
I think that admitting that is the first step, isn't it?
Yeah.
Yeah, no, I think that especially when it comes to devices, I think that that's sort of the challenge. I think it's such a big project that people look at it as a mountain that they can't climb instead of chipping away at it. And for that, you kind of need someone who understands how to chip away and approach it from a strategic thought process rather than just trying to take it all in at once, which will fail.
Yeah, and I've seen so much success from your organization, and the bench is so deep. I'll just say that. And then, we're coming down here on the end of this. Just quick summary is, look, asset management, you got the FDA coming out, but you're still going to have legacy. Your devices are going to be legacy. You're going to need to do something about those. With doing it the way we do it, we get a lot of data, rich data out of the network on the devices, and translating that into, do you have too many infusion pumps? Are you using your imaging systems most effectively? How can you renegotiate your contracts so that you don't necessarily need platinum level support on these particular contracts? All sorts of crazy. It's like you're buying an asset management product that actually does cybersecurity. It's kind of oh gosh, I forgot the word. I must be getting tired. Intuitive, but really it's for cybersecurity, and as Jessica was saying, really focusing on patient safety and not the data protection, although you still have to have it, and communication with for information sharing with like HISAC, and if you're going to go out into the industry and talk about it, don't go with fear, uncertainty, and doubt as much as here are some ideas for solving the problem, and information. This is what we did wrong, and let's get away from punishment and more into the synergism. Resilience is getting back up quickly, because like Jessica said, it's not if, it's when, and then keeping the business continuity moving forward. In the presentation, if you want this presentation, please email me, Linda, or Jessica, and we'll send it to you. Because look at these are just some of the articles that Jessica has written. It's just a wealth of information, and great if you have an insomnia problem. I'm joking, Jessica.
Okay, well,
but
don't worry.
it is a lot, yeah. So great to be here today. I don't know, Linda, is there any questions? We only have a couple minutes left, but if somebody's got some burning questions for Jessica.
We've got time for one question, Ty. How do you think AL will impact healthcare cybersecurity?
Well, I think it already is in some ways. I think that for AI, when it comes to developing malware, they've seen some threat actors doing it, but I always sort of lean on the idea that, threat actors are still getting in the same way. We talk about AI a lot when it comes to machine learning and picking up, ensuring that your governance is put in the right place. Like if you're using a ChatGPT, because there are studies that show how important ChatGPT and tools like this are to the healthcare industry. We're already seeing use cases, so ensuring that your governance is on there too. So there's two different ways. From a threat perspective, they are using that to sort of dupe people, but in the same way, it's more common that you're using that or trying to do that on your network. It's important to just make sure that you have the right things in place to make sure you're not introducing new vulnerabilities in the same time.
Perfect.
Yeah.
Thank you. Lovely way to wrap up our hour. So thank you so much, Jessica and Ty, for your time today and for a really great and informative presentation. I'd like to encourage everyone to visit today's sponsor to learn more about the products they provide for our industry. So please visit clarity.com. As promised, the answer to today's trivia question is mustard, closely followed by ketchup. So congratulations to our winner, Mark Lauteran. Just a quick reminder to obtain your C certificate by completing the post-webinar survey. The survey will be emailed 1 hour after the completion of today's webinar, and you must complete the survey to receive your 1 CE credit from the ACI. You'll be able to download the certificate directly from your computer once you've submitted the survey. If you have any questions, you can reach us at webinar@mdpublishing.com. We'll be back next week with another webinar, so please visit webinarwednesday.live for more details and complimentary registration. So thank you all for your time today, and I hope you enjoy the rest of your day.
Thank you, Linda. Thank you, Jessica.
Thank you.